Hello, Perry. It's Dr. Rebecca Brightman here to answer this week's most commonly asked question, which is, should women start taking supplements or hormones during perimenopause? And are hormones safe, and do supplements work? Well, it's a great question, and I think when women start suffering with perimenopausal symptoms, they reach out to their sisterhood, for example, or they're very intrigued and compelled by things their friends may have tried, or ads on TV, or ads on the radio, or certain things they've seen, when they've been surfing the web. So in terms of supplements, many of them that are found to be effective work because they contain substances that are found in fruits and vegetables called phytoestrogens. And these substances have weak estrogen-like properties, so they're not ideal for everybody. And for example, if a woman has a predisposition towards breast cancer or actually has breast cancer, this is something she should discuss with her healthcare provider. There are other non-hormonal products that are out there, and now they're actually being marketed for women in perimenopause, not just menopause. So those that do not contain phytoestrogens, certainly they're worth trying, as long as there aren't any reasons not to. It's important to, I feel, discuss the use of all supplements with one's healthcare provider. Certain supplements can impact bruisability, so one wants to discuss things certainly in advance of having any kind of surgery. There is a pollen extract supplement that's available in the States, as well as Europe actually, and it does not have any estrogen-like properties. So these are important things to think about when one considers a supplement. Also, it's important for women to realize that supplements, unlike drugs, do not require approval by the FDA. So they don't have to undergo the same scrutiny as, let's say, a prescription-like medication. And the other thing is there isn't a lot of clinical data about many supplements. And when you look at the data, again, the numbers are small. And in some situations, because the numbers are small, there may be somewhat of a placebo effect. However, my feeling has always been, if you're a woman who really benefits from using the supplement, it doesn't matter. If it works for you, that's great. And again, talk to your healthcare provider. In terms of hormone use during perimenopause, it's really nice for many women, particularly those with severe perimenopausal symptoms, because it creates a state of hormonal neutrality. What happens during perimenopause, there are hormonal highs, there are hormonal lows, and using something such as, for example, hormonal contraception, a patch, a vaginal ring, an oral pill really helps many women. Women also can start some hormonal therapy, but it's important that they strike an appropriate balance between estrogen and a progestin use. I think women are really drawn to the use of supplemental hormones, but they really need to be given in a very, very controlled and careful manner. There are a lot of healthcare providers and people who aren't necessarily OBGYNs, or people who are out there not specializing in menopausal medicine, who are very quick to give hormones, particularly compounded hormones, which my feeling are many of these compounded hormones are not necessarily as safe as those that are FDA approved. I tend to prescribe almost exclusively FDA approved hormones in my practice. But again, the need for hormones has to be individualized. Not all women are candidates for FDA approved products. For example, if they have a reaction to them, then perhaps something compounded is more appropriate for them. In terms of the use of hormones, when used for a short duration, they are felt to be safe. But again, this has to be individualized, and this is something I review with my patients during each annual exam. So during the exam, we obviously discuss hormone use as well as the use of nutritional supplements.